before he really sees the sky. How many years must one person have before he can hear people cry?
Good morning. Welcome to Auburn Unitarian Universalist Fellowship. My name is Jim Bradley, and I will be serving as Service Associate today. If this is your first time here, or your 101st time, we are glad you are here. If you carry the weight of a weary world on your shoulders, or you enter through the doors with a song in your heart and a skip in your step, we are glad you are here. If you are the loudest voice in the town square or the subtle hand behind the scenes, we are glad you are here. If you have failed once or 1,000 times, we are glad you are here. If you sing like angels or mumble behind the hymnal, we are glad you are here. This community is what it is because of your presence. So welcome. Welcome to this space of love, support, justice, compassion, fellowship, and worship. We are glad you are here. On behalf of the members of the fellowship, I extend a special welcome to all visitors who are joining us online for the first time, or those of you who still feel like visitors. If you have not already done so, please fill out a digital visitor card by visiting auuf.org/visitor so that we may welcome you. You may also contact our minister, Reverend Chris Rothbauer, at minister@auuf.org with any questions or concerns you might have. Now let us move into the service, willing to be authentic with each other, honest with ourselves, and opening to connection in all of its forms.
Our opening words are from Sharon Wiley. It is said that ministers are here to comfort the afflicted and afflict the comfortable. I say we are all afflicted and we are all comfortable. May our time together this morning be a comfort and a confrontation. May we find peace in times of tumult. May we here invite tumult into lives of peace. May we here find calm in times of restlessness. May we here allow restlessness to evolve into action. Let this be the place you consider what you've never considered. Let this be the place you imagine for yourself something new and unthinkable. May this hour bring dreams of new ways of being in the world. Come, let us worship together.
The words for our chalice lighting today are by Jamie A. Yandel. And I invite you to light your home chalice with us this morning as I read Jamie's words. We light this flame to ignite the sacred power of justice. We light this flame so that it may be a beacon of hope in moments of uncertainty, fear, anxiety, and the unknown. We light this flame and are emboldened by its blaze. Knowing our strength as a prophetic and powerful people is rooted in the diverse ways that we answer the call to love. And as is our tradition, we also at this time light a candle in solidarity with those families separated at our southern border. Now I'd like to invite you to join us in our opening hymn, hymn number 361 in the gray hymnal. Enter, rejoice, and come in. The words will be shared on the screen.
Enter, rejoice, and come in. Enter, rejoice, and come in. Today will be a joyful day. Enter, rejoice, and come in. Open your ears to a song. Open your ears to the song. Today will be a joyful day. Enter, rejoice, and come in. Open your hearts, everyone. Open your hearts, everyone. Today will be a joyful day. Enter, rejoice, and come in. Don't be afraid of some change. Don't be afraid of some change. Today will be a joyful day. Enter, rejoice, and come in. Enter, rejoice, and come in. Enter, rejoice, and come in. Today will be a joyful day. Enter, rejoice, and come in.
Thank you, choir. One of the ways that we proclaim the warmth and caring of our community is by sharing our joys, concerns, and milestones. We invite those who wish to use the Zoom chat box to type your joy, concern, or milestone during the music for meditation. If you wish for your joy or concern to be acknowledged but don't want to share it, you may also type that you have an unspoken joy or concern. Thank you, Andrew. Your music's always a special treat. Thank you to all who shared your joys, concerns, and milestones this morning. Now, the following joy was submitted in advance for sharing. Marcia Rossi shares that her father, Chuck Rossi, turns 91 this Saturday. And she says, stay tuned for information on a virtual celebration. And now we're going to cut back to Reverend Chris for a special joy.
I actually want to invite Laura and Martha to come up here really quick.
That's getting old songs. Over here. Over here. I'm sorry. We need Andrew to step up here, please. I sent email out to what we're calling the COVID choir because we wanted to show our appreciation to a couple people who've gone above and beyond during this time. And if there was some way I could have figured out to send it to the listserv without Daryl finding out, I would have, but since he's in charge of it, that was a lost cause. So we want to thank Andrew for doing his job as a music chair and entertainer and humorist and all-around good guy. We're glad you're here.
Oh, thank you.
Yay. We also want to thank our master of electronics over here, who I refer to as our computer geek. Say it lovingly.
Thank you very much.
Personally, thank you for everything you've done. I mean, you could have charged us twice as much as you normally do. So,
It's my pleasure.
thank you. Thank you, Daryl.
Thank you.
You deserve that and so much more. Thank you.
Woo!
I hope everyone online today will join us in thanking Daryl and Andrew for all they've done during this time.
Thank you, Daryl and Andrew. And now may all the joys, concerns, and milestones of this community, those shared aloud and those held in silence, be received into the care and concern of all present. This religious community exists by its mission as a fire exists by burning. But a fire cannot burn without fuel. And it is the time, the energy, the imagination, the vision, the creativity, the compassion, the love, and the financial support of the members and friends of this community that fuels our mission to nurture and sustain a welcoming, inclusive, and diverse liberal religious community that transforms lives and serves the world. Your support, the free and generous support of each and every member and friend of this community, is what fuels this community and its mission. And without your support, the flame of justice, community, and love cannot burn brightly to warm ourselves and be a beacon in a world threatened by division and fear. So, to make a donation online via PayPal, please visit auuf.org/donate. And if you're writing a check, please make your check out to AUUF with a note on the memo line about whether it is for the offering or for a pledge. And you may mail it to P.O. Box 669, Auburn, Alabama 36831. The offering will now be gratefully received. Well, that settles it. I want kids to rule and run the world. Our reading today is by Paul Stephen Dodenhoff. And the title of the reading is, Yes, I Want to Live in a Welfare State. For years now, my conservative friends have asked me, do you really want to live in a welfare state? Well, I've thought about it and I've decided, yes, I do. I want to live in a welfare state. If we define welfare in the original meaning of the word, the condition of being or getting along well, to fare well, then yes, I want to live in a welfare state. If welfare means that my well-being and the well-being of everyone else means that we all have healthy food, clean water, clean air, proper housing, and affordable, if not totally free education, and full access to complete health care throughout our lives, then yes, I want to live in a welfare state. If welfare means that we take care of the earth and the destructive practices that are poisoning the planet we are blessed to share, and begin to implement policies and practices that support and sustain our lives and the lives of generations to come, then yes, I want to live in a welfare state. If welfare means that people and not corporations and corporate profits are the primary concern of our politicians and our national and international policies, then yes, I want to live in a welfare state. If welfare means that the rights of all people to live in safety are protected by sensible laws that protect the citizens and children against violence and those who would place personal freedom over the good of all people, then yes, I want to live in a welfare state. If welfare means that all people, regardless of their color, spiritual or ethical beliefs, gender, sexual orientation, or political views are afforded the same rights and privileges as everyone else, then yes, I want to live in a welfare state. If welfare means that all people without exception are given the right to vote without fear of harm, reprisal, or discrimination, and that money plays no part in whether a person can run for and hold office, then yes, I want to live in a welfare state. If welfare means that our justice system does not favor corporations or one part of society over any other, then yes, I want to live in a welfare state. And if welfare means that our prison system is one that is not run by or for profit corporations, that its purpose is restorative and not retributive or punitive, and one that sees the humanity in all people, difficult as that may be at times, then yes, I want to live in a welfare state. If welfare means having an economic system that is not exploitive of workers and does not perpetuate an oppressive class system, one that ensures that all people have the dignity of work in a fair and livable wage, then yes, I want to live in a welfare state. If welfare means that our system of taxation is fair, progressive, and free of loopholes that favor the wealthy and corporations over all others, then yes, I want to live in a welfare state. If welfare means that each of us care for the other, that the least among you is cared for and loved as much as everyone else, that racism, sexism, ageism, and all other negative and harmful isms become a thing of the past, that we all support each other in living our lives to the fullest potential, and that we are all faring well, then yes, I want to live in a welfare state. In fact, I want to live in a welfare world.
I'm a renegade and a fairy fire, carrying on those things high and low, under your feet and
Where's Ben? Ben, up. We've got to leave
I'm
soon.
not feeling well.
You're not going to get out of going to school that easily. Up. You can't be late. Mia, come. We're going to miss the bus. Ben's not doing well. Did you manage to get the medicine?
No, they didn't have any.
I'm sorry you're feeling so horrible, my darling. And how much is it going to cost? Are you sure? Just for an appointment. What if we don't have the money?
Tell them about his fever.
I have. No, I wasn't talking to you, sorry. Surely there's got to be something you can do for us. What if he gets worse?
No, it'll be okay. We'll find a doctor tomorrow.
And how much is that going to cost? Listen, you get me to school, I'll take Ben to the clinic.
You sure?
It's fine, go to work.
Mom,
What's Mia?
Ben needs help.
Tom, we're gonna have to get a taxi. Please call one now.
It's hard to believe that a statement like everyone deserves to live a long, happy, healthy life is controversial in our current political climate. But that's the reality we currently live in. In the United States, we so often tie access to health care with the ability to pay for services. For many of us, this is directly tied to the health insurance. And in our system, most people receive health insurance through our jobs or through our spouses or partners' jobs, which makes it really, really hard if you become unemployed or need to change careers. For so many of us, we are a job loss away from losing access to quality health care. And COVID-19 has only exasperated this situation for so many. To top it off, there are so many rules surrounding health insurance and employment that a significant number of gainfully employed people remain uninsured. This is an everyday reality. In 2018, 27.5 million people in the United States were uninsured. That's 8.5% of people in the country who, if they had a health crisis, would not be able to access potentially life-saving medical interventions without risking the prospect of debt and bankruptcy, to speak nothing of preventative medicine that could keep some of these folks from getting sick in the first place. And that's not even counting the number who were underinsured or had a coverage gap. According to the Commonwealth Fund, in all, 87 million people, or 45% of the United States population, were inadequately insured in 2018. It's criminal to consider that nearly half the population in our country does not have access to quality health care without facing the specter of financial ruin. This will have real consequences on their lives, leading to delays in getting essential medical services, problems finding care, and trouble paying bills. In all, these folks will probably have a shorter life than those who were fully insured. And though some indigent care is available, much of it focuses on merely treating immediate threats to life, as opposed to things that will eventually threaten life in the long term. A fact that I found out all too well when I worked in a hospital and watched as we patched up person after person and sent them back on the street. For me, this is a very personal topic. Many of you know I grew up in a poor and working class home. And my mother, over the course of her life, developed a nearly divine tolerance for pain, frequently putting off trips to the doctor until she just couldn't stand it anymore. We never had much money, and her health insurance through the fast food restaurant she worked for wasn't very good. Delaying care became a way of life for her. It also probably eventually killed her. The last time I saw my mother, the Christmas of 2015, she was obviously in a lot of pain, and I was worried about her. But with her usual grit and bear attitude, she assured me she could handle it. She was out of breath and sweating just from climbing a set of stairs. But she would take care of it if she needed to, she told me. Within a couple of months, she finally couldn't take it anymore and went to the doctor. In February of 2016, she was diagnosed with stage 4 cancer. She was dead within 3 weeks. That's how long she put off care. She had other health scares in the past that nearly cost her her life. But this time, the pragmatic habit of delaying treatment finally caught up with her. I can't help but wonder how things would have been different if she was fully insured under a socialized program, as is prevalent in so many European countries. Would she have ever developed that habit in the first place of putting off care if she didn't have to worry about paying for it? Would she still be alive today and be coming down to visit me and meet all of you and upset with the rest of you that my installation was delayed? The congregation, meeting you all, the congregation I'd no doubt be bragging and raving about to her. I'll never know, of course, but I'd like to think that things could have been very different. American journalist Walter Cronkite, who some people have been sharing a meme about claiming he never got political, once said that America's healthcare system is neither healthy, caring, nor a system. Our current system does not even do the bare minimum necessary to keep people in our country healthy. Like my mother, so many people face the daily dilemma of whether to get care at the risk of possible financial ruin if they're not able to afford it. There are many reasons why healthcare is so expensive in America right now, but if condemning people who can't afford it to death seems a bit well off to you, then you're not alone. And of course, the system disproportionately harms those on the margins, the poor, people of color, immigrants, both documented and undocumented. sexual and gender minorities, the disabled, and those with mental and physical health challenges. The system for these folks seems to be set up to fail. The fact is that our health system is built not on the premise of helping people when they need it, but it's built to make the most money possible. If it helps people in the meantime, that's a nice byproduct. But the entire thing is set up for insurance companies to make as much as possible while stacking the odds against those who are un- or underinsured. With very few exceptions, the system really does not care whether you live or die, as long as they get their money in the end. And this became all the more prevalent when calls came out from some lawmakers that older folks needed to be ready to die, to sacrifice themselves to save our system in the midst of this current pandemic. Before COVID-19 hit, we were planning on launching a medical debt forgiveness project here at AUUF, and I'm still planning on going back to that eventually. But even that will just be a Band-Aid over a much larger problem, because even if we were able to forgive every penny of medical debt in this country, come next year, there will already be millions more. Even the legislation you're going to hear about today, which would no doubt ease the problems here in Alabama, would only be a small step towards comprehensive health care coverage. It would somewhat slow the suffering for some, but as long as the system isn't dismantled and replaced, the cycle will continue. The problem, as I see it, is that the system has become so ubiquitous that it's difficult, if not impossible, for many to even imagine what another way would look like. We've agreed that this is the way things are, and we've lost our sense of imagination of how they could be. The reality is that neither major party presidential candidate in this year's election supports a systemic overhaul to the healthcare system that would really do much more than we've already done. There seem to be very few prophets among those in power ready to hold the vision of what's possible. And that's why whoever gets in office in November, we're going to have to pressure them. But imagine if we recreated society in such a way that the profit motive didn't keep people from being able to not only survive, but to thrive to their full potential. What if we employed compassion instead of number crunchers to make sure no one need even think about their ability to pay in order to have access to quality health care in our nation? What if everyone just had health care? Because we saw it as just something we have to have, an inalienable right akin to food and water and the very air we breathe. Mind you, we don't do terribly good in those other three either. But we can get better. It's easy to say it's a pipe dream, but it's already being done in many countries all over the world. And while none of those systems are perfect, they are a step up from our current reality. It's time for something different. It's time for us as people of vision and compassion to demand our government officials either eliminate the inequities that prevent so many in our society from getting quality health care, or else step down from their posts and let someone else in who will. To stop tying health care to jobs and ability to pay. Because as long as they aren't serving everyone in our society, they aren't serving the people. I close with a prayer from an unlikely source this week that I hope will remain on your lips. From American actor Brad Pitt. Let us be the ones who say we do not accept that a child dies every 3 seconds simply because they do not have the drugs you and I have. Let us be the ones to say we are not satisfied that your place of birth determines your right for life. Let us be outraged. Let us be loud. Let us be bold. May it be so. Well, last year, I started what I hope will become a new tradition, where on fifth Sundays, we have social justice or interdenominational Sundays, and our social justice focus, as you've probably gathered this week, is healthcare. And we have a very special reflection this morning from Jim Carnes of Alabama Arise about some legislation here in Alabama that would significantly make an impact on the current system. So I'm going to ask Daryl to go ahead and cue that up, and we'll hear from Jim.
Good afternoon. I'm Jim Carnes. I'm Policy Director at Alabama Arise, and I want to thank you for lending me your ear for a few minutes. I'll try to keep it to a few. I'm coming to you from my backyard in Montgomery on a Monday afternoon where tomatoes have peaked and summer is waning. There's a cloud cover, so I can actually sit outside on an August afternoon, and I'm thankful for that. I want to beg your pardon in advance for my dogs. They get very excited about Medicaid expansion, and they're out here with me today. They're Rosie and Trudy, and I'll try to get them to curb their excitement. Thank you, Jim, for your invitation. I know that you all are probably familiar with the broad outline of Medicaid expansion, but I want to hit some high spots and ask you for your help. Number one, COVID has taught us some strong lessons about Medicaid expansion. It's taught us that too many of our essential workers are in the coverage gap with 300,000 or so other Alabamians. It's taught us that having a coverage gap where people go without health insurance and regular health care is extremely costly in a pandemic emergency, because underlying health conditions make individuals more vulnerable to the opportunistic COVID virus, as we're seeing in the severity of cases among people with chronic conditions, and most concerningly, considerable mortality risk for people with chronic conditions. So getting Medicaid expansion will help us address that. Number two, I want to point out that Alabama has come a ways. Some of our leaders have begun to see the light, and we just need to make it easier for them to make a change. We need to make it easier for them to admit that they've been wrong for 10 years. I don't care what they call it. They could call it Ivy Care, they could call it Alabama Care, whatever they want to call it. But they just need to do it. And working together, we can press the point and help them find their comfort zone. We need to talk with them about how to reckon the cost. They are too narrowly focused on the 10% state share for expansion costs, which would amount to $168 million a year in year one, $168 million year one, and $25 million a year thereafter. We need to get them to broaden their focus and look at the cost of not expansion and the gain from expanding. When we think about the cost of failing to expand, we're talking about a diminished workforce capacity talking about people who are going to work sick because they don't have a way to pay for health care. When they do get sick, it's more costly in time and money, and it further hampers their productivity. So we're also talking about the cost to rural hospitals, who are bearing a disproportionate share of uncompensated care, meaning that they're providing care free of charge to people who cannot pay because they don't have health coverage. And as a result, 88% of our rural hospitals are operating in the red, losing money every year, which makes them more vulnerable to something like COVID. And we also need to talk about what's to gain in our budgets. Our investment of $168 million in year one and $25 million thereafter would bring us $1.7 billion per year in direct federal spending on health care. This is according to David Becker, a health economist at UAB. And further, it would bring us $1.2 billion in annual indirect economic impact. Those two things in turn would generate, through salaries and spending in the community, would generate state and local tax revenues. Our state revenues would see $148 million a year increase, and our localities and counties would see a $90 million a year increase. Any factory development, economic development plan that promised to do that, plus create 31,000 jobs, as a UA study showed, would get a parade from Huntsville to Mobile. So we just need to hold our legislators by the hand and show them that Medicaid expansion is an economic development tool. It's really an economic development bonanza. Further, I want to say that once they do expand Medicaid, they will be joining 37 other states that have expanded, none of which have turned back. Every state that has expanded has moved forward. They've seen the benefits. The new research is coming in by the month, showing the health benefits and the economic benefits of expansion. Alabamians deserve the opportunity to have affordable health care that our fellow citizens in other states are getting. And we pay federal taxes just like residents of every other state. But our federal taxes are going to help Kentuckians and Louisianans and Arkansans and Hawaiians get affordable health coverage. They're not helping us here in Alabama. We need to bring our federal tax dollars home to expand Medicaid. Thank you so much for your time. I know I've overstayed my welcome. I don't know why my dogs have been shy, but I assure you they are just as interested as we all are in moving Alabama forward through Medicaid expansion. Thanks again, and please count on Alabama Arise to provide whatever information might be useful to you for making your case to your lawmakers and your community members. Thanks, take care, and be safe. Bye-bye.
Jim, you're muted.
Okay. I'd like to thank Jim Newton for getting that excellent video for us from Jim Carnes in Alabama Rise. Well, today's service is really meant to focus on action that each one of us can take to improve health care in Alabama. Just knowing about a social injustice does not solve it. Action is required. So the question comes up, what action can we take today, and I mean today, toward alleviating the social injustice of 300,000 Alabamians floundering in the health care gap that makes them ineligible for Medicaid? Well, we can do something. We can urge our elected state officials to join the 37 other states that have chosen Medicaid expansion. So to this end, each of you on the AUUF Connect listserv will receive an email immediately after the service that contains links for online letter writing to Governor Ivey, Senator Tom Whatley, and State Representatives Lavorne and Warren. Along with this contact information will be a few salient points about how Medicaid expansion in Alabama will not only help persons in need of health care and help rural hospitals stay afloat, but also increase jobs and increase revenue for the state, as you just heard. Please prioritize your letter writing today so that you do it right away before lunch, before a nap, and before whatever personal enjoyments you may have planned for this afternoon. And if you're an out-of-state visitor at our service today, I encourage you to find out whether your state has expanded Medicaid, and if it hasn't, to write to your state representatives and urge action. Now, if you have any questions about Medicaid expansion or letter writing, Jim Newton will be happy to answer these during the coffee hour or during a breakout session immediately after the service. So happy letter writing, everybody. It's most important to write Governor Ivey because she's the one that makes the decision, and then write Senator Whatley and your House representative in order to urge them to encourage Governor Ivey to take this action. Okay, now it's time for our last hymn, and the hymn is number 1014, Answering the Call of Love. And I'd like to invite you all to join us, and the words will be shared on screen.
The promise of the Spirit
Please join me in extinguishing our chalice. You'll find the words on screen. We extinguish this flame, but not the light of truth, the warmth of community, or the fire of commitment. These we carry in our hearts until we are together again.
I have 4 short announcements. Well, first, please be our guest today after the service for a virtual coffee hour here in this Zoom room. We will be creating breakout rooms to encourage deep conversation and reflection on this morning's service, or if you just want to talk about your week. Simply stay in this room following the service and you will be automatically invited to a break room. Next, if you're not signed up for the AUUF Connect listserv, please make sure you do so to receive updates about ways to connect virtually during this pandemic time. You can find information on signing up at the website auuf.org/subscribe. And then also, as we begin our Touchstones theme-based ministry in September, we are looking for people willing to facilitate virtual second-hour sessions. Thanks to our Touchstones materials, the second-hour team can suggest possible articles and videos for discussion. If you are interested in leading a second hour in the coming weeks, please contact Chris Bozier. And finally, the Congressional Support Committee truly appreciates the ongoing support of the Diana's Pantry program. If you are in need, or if you know someone who is in need of grocery or household items, please contact Eddie, Noriko, or Emily. Applications are accepted year-round. Now please join us for our song benediction.
Go forth into the world in peace, in peace. Be of good courage, hold fast that which is good. Go forth into the world in peace, in peace. Love all people, rejoicing in the power of the Spirit. Go in peace.
Our benediction is from Robin F. Gray. As we prepare to depart, we give voice to these hopes. May we know ourselves bound in community even while we are apart. May a passion for justice burn in our lives. May we carry the light of compassion in our hearts and in our every interaction. May we be whole in our devotion to truth and always carry the lamp of peace before us. Amen. Blessed be, and go in peace.